being open to an IPR made public at this point of time for the world or for the humanity or all the countries at large is not the issue, Rahul. The issue is that biological processes are not so simple that they just work with an IPR and what is written in a patent document in black and white and submitted. Kiran, I know, is nodding her head, and I know what she's going through in her mind as well, is that there is so many interlinked processes, technologies that are again connected to different sources from where these materials and adjuvants and so many other in process areas of techniques and processes come. So they're all interlinked to the whole world, Rahul. This is not just with Bharat Biotech and having one patent document or an IPR document and handing it over to somebody.
Dr. Shaw, do you agree with that? Because there's a very strong demand that especially with CoVaccine through Bharat Biotech, this be made available so that other companies can jump in. What's your non-partisan view on Dr. Ella very clearly not wanting to make that public, IPR public, saying that it's not as if she wants to hold on to it, but it's not practical for other companies to start manufacturing. What if these vaccines start having adverse reactions? It'll impact the vaccine credibility process.
Quality.
So Rahul, let me put it this way. I think it is the politically right statement to make, because I think that's what is happening. This is a good rhetoric to have globally, because at a time like this, when we want vaccine adequacy and vaccine equity, obviously everyone wants vaccines to be produced at huge scale. And we know that right now we don't have the global scale required to provide global equity to all these vaccines. As you know, many parts of the world are starved of vaccines. So whilst it is great to say that we need to have patent waivers and we need to basically get into compulsory licensing, I think as Suchitra very nicely explained, I don't think the lay person or the politicians or the policymakers realize what biological processes are all about, what technology transfers are all about, and how long it takes to start from lab to scale up in terms of producing a quality product with all the quality release requirements and regulatory requirements. It takes anywhere between 9 months to 12 months, to say the least, to take, say, a Bharat Biotech vaccine. Even if Suchitra was saying, I'm willing to share my technology, let me tell you that if Bharat Biotech was to share the technology and transfer the technology to a company like mine, believe me, it will take at least a year before you can produce anything at decent scale.
If I were to ask you to critically evaluate the plan to scale up that's been laid out by Dr. Ella, what would be your analysis? Because Bharat Biotech so far has been doing roughly 5 million doses every month. She's now talking about increasing that to 1 billion per year. That's 100+ million per month. That's a 20x increase over current production levels in a very short time frame. She's enlisting new facilities. Is that achievable, Dr. Shah?
Well, I think what she explained today was that she's actually started her process in Hyderabad, where she knows the technology, where they know what is required to scale up. Of course, it's not going to be possible for her to scale up next month. But I think knowing that you have a technology, and I know that even in the Bangalore plant, they've been working for the last several months. It's not like they're working today. So now that they worked for the last 6 to 7 months to see how they can scale up that technology, I think it can be coming to a stage where they're able to scale it up. Now, I think she also mentioned Ankleshwar, and I'm sure they've been working on the Ankleshwar facility for some time. So it's not like you switch it on today and tomorrow you can produce the 20x scale. It does take time, but from my knowledge, and Suchitra, correct me if I'm wrong, I think you have been working on the scale up for several months now. So what she's sharing with you now is several months of effort to get to this scale up stage. And even at this stage, of course, I'm sure Suchitra knows that it is not slam dunk. She is going to have to basically scale it up. Once they commission it and get it off the ground, it's going to take a few more months to get to that scale that Suchitra is talking about. So I think the kind of billion dose kind of scale that Bharat Biotech is trying to aim for, in my view, I would think would only come on stream maybe early next year. I mean, realistically speaking.
Okay.